Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is David.
And my name is Emily. Today, we will be discussing the different types of aphasia. So aphasia is an acquired communication disorder caused by damage to areas of the brain responsible for language, which for most people is located in the left hemisphere of the brain, and more specifically, the parieto-occipital cortex. An individual with aphasia will demonstrate difficulties with speech and language and have impaired language comprehension, formation, and use. It is estimated that aphasia occurs in 30 to 36% of all patients who experience a stroke or a CVA. So this is definitely a common impairment seen. These various types of aphasia include fluent aphasia, non-fluent aphasia, and global aphasia. So what is fluent aphasia? This type of aphasia is also referred to as Wernicke's aphasia, sensory aphasia, or receptive aphasia. It is characterized by impaired auditory comprehension. However, their speech will be fluent. What do I mean by this is that the speech will have a normal rate or melody and will flow smoothly. The individual will demonstrate difficulty comprehending or understanding spoken language and will have difficulty following commands. The individual's ability to read or write will be severely impaired, and they will have difficulty with naming and repetition. With Wernicke's aphasia, the lesion will be present in the posterior portion of the first temporal gyrus of the left hemisphere.
Since Emily discussed fluent aphasia, I am now going to discuss non-fluent aphasia. This is also known as Broca's aphasia. It may also be referenced as expressive aphasia, motor aphasia, or verbal aphasia. This type of aphasia is characterized by limited vocabulary, a slow and hesitant speech, and impaired syntax, which is the arrangement of words to create sentences. As the name suggests, the patient may present with a non-fluent speech, meaning that the speech will be labored or lost completely. It should be noted that comprehension, such as reading, is going to be good. The individual's ability to write, for naming, and also for repetition is going to be poor. The lesion will be present in the anterior region of the third frontal convolution of the left hemisphere. Another important form of aphasia to discuss is global aphasia. Global aphasia is the most severe form of aphasia. I'm going to restate that. This is not a type of aphasia, but it is a severe form of aphasia. The individual will present with impairments in both production and comprehension of speech, as the speech will be non-fluent. The individual's ability to write, to read, for repetition, and for naming is going to be poor. The lesion will be extensive damage of the left hemisphere, which means that it can be anywhere in the left hemisphere and sometimes bilateral.
It is important to note that on this episode, we have only reviewed a few of the main types of aphasia that an individual can present with, and that there are other forms of aphasia, such as conduction aphasia, transcortical sensory or motor aphasia, and mixed transcortical aphasia or anomia. If you are not familiar with these types of aphasia, now would be a good time to go review these in further detail to help you best prepare for your upcoming exam.
Now that you understand the different types of aphasia, here's a quote from Mark Twain. "The secret of getting ahead is getting started." So keep on pushing yourself to take a step forward. keep on progressing forward, keep on pushing forward, and keep on fighting for your dream. You are powerful. You are strong. You are a final frontier warrior, and you will pass.
Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok.
Till next time, have a great day and a powerful tomorrow.